Good afternoon. And today we have a pleasure to interview really hotshot Dr. Kevin Boyd. He is very well-known dentist, but in addition to that, he has a lot of work in the field of anthropology. And he's consulting scholar for University of Pennsylvania Museum of Anthropology. And we're going to ask him a lot of questions, how anthropology, research in anthropology can shine the light on the situation we have right now with obstructive sleep apnea, with lack of growth and development for the future generation, for our kids, and how it all can affect sleep. So good afternoon, Dr. Boyd.
Good afternoon, doctor. Thank you for inviting me.
And thank you very much to our audience. If you have trouble sleeping or sleep next to the snoring partner, this program is for you. It can shine a light on a lot of routes to roots. If you're a medical professional who, just like us, very passionate to put all puzzle of obstructive sleep apnea and evolution together, please click the like and share button, because only together, working as a community of different professionals, we can find all missing pieces of that silent killer. So my first question to you, Dr. Boyd, I'm not gonna even do that official reading your bio, because I want you to tell our audience about your pathway, how you arrive to the point of destination where you right now. And I want you kind of start early. I learn about you, as preparing for that interview. And I want you personally to share with our audience how, path from education in nutrition and wellness, and then dental education, and then your own work in University of Pennsylvania Museum of Anthropology, also in University of Arkansas, right? You work as a faculty, also teaching students about anthropology. How you put all of it together, and it's inspired you to a lot of articles, what I read before this interview. Please tell us about your pathway.
How much time can I give for this answer at a time?
Yes, you have to give for that answer. Yes, don't do that in a very long time, because that's going to be difficult for the audience, but put it in a brush stroke.
Okay, here I go. Not my forte, but I would say it started reading a book in the 80s called The Origin about Charles Darwin. It was a historical fiction. So that really started it. Then fast forward to 2008, maybe 2006, I attended a lecture at the University of Washington. And Philippe Houjoul, Belgian periodontist and public health dentist. And he showed a picture that showed that tooth decay did not show up in humans till about 12,000 years ago. And I said, that can't be true. I would have learned that in dental school. And then I realized how much I did not learn in dental school, because evolutionary biology and anthropology is not part of the curriculum. So that's how it started, period. And so let me just end there, because it led to what it is now. So
I would like to ask you how your education in nutrition and the knowledge on that affect your philosophy towards practicing dentistry, especially pediatric dentistry.
One component that's left out of nutrition education, I have a master's degree in nutrition and dietetics from Michigan State University, and I was going to be a dietitian. The way they teach dietitians is in nutrition means nutrients. It's biochemistry. How do nutrients get into our cells, and what nutrients are important, and what do they do once they're in the cell? That's dietetics. And there's nothing about chewing. There's nothing about texture. And that's what's left out of nutrition education. I feel I'm criticizing it, and it's left out of dental education. What are teeth for? They get cavities. They get gum disease. What about chewing, and what about the bones that support them? That's a big void in education. So that's my only comment on that.
I talk a lot about the fact what us, as adult as well as our children eat such a mashed up food. We would say, oh, this food just melting in my mouth. So nobody used the jaw. As a dentist as well as master in dietary science, how can we change that paradigm from that melting in our mouth food to the food what actually serve as exercise?
Okay, I'll try to give this 30 to 40 seconds. I just wrote a commentary to the Journal of the American Medical Association on an article they published. The British Medical Journal had published on ultra processed foods. Okay. And what they went on for 15 pages was all about the nutrients and all about the diseases, and 35 diseases caused by ultra processed foods. They mentioned as a component, a characteristic of ultra processed food is soft texture. They didn't say soft texture, they just said texture is important, that they didn't say why. They didn't say one word about it. So I wrote something very maybe pejorative. I wasn't trying to be deliberately, and it's published. They informed me this morning it's published in JAMA. So I encourage people to go online in JAMA and read my commentary, and I won't say anything else, but you're onto something, Maria. You are definitely onto something.
Okay, now I want to ask you the question towards anthropology. You advocate as a visiting scholar of University of Pennsylvania Museum of Archaeology and Anthropology. Tell us how your research in anthropology intersect with your work in dentistry. What do you see in a modern mouth? What you can kind of relate to what happened over the century, what you see in the museums?
Modern is another term for post-industrialization, cultural industrialization. So things changed remarkably. Humans have been around. Our genome has been around for 300,000 years. We were hunter-gatherers. There weren't very many of us. But guess what? We all died. If we survived childhood, we lived to reproduce. We died with our wisdom teeth fully erupted. All the teeth, the jaws were wide forward face, or you did not survive long enough to reproduce. Okay, so that's ubiquitous in pre-industrial skulls, which we study at the Museum of Archaeology and Anthropology. Mariana Evans and I, a dual-boarded periodontist orthodontist, and we noticed that all of the skulls that we looked at, no matter what age, had perfect jaws. So the hypothesis is you had to have perfect jaws from birth in order to survive childhood, period. So we are proponents of getting in there early. So that is pretty much, we use the data that we collected from the museum, pre-industrial specimens that we have cone beams on. We took them to her office and we did x-rays on them 3-dimensionally. And we use that to inform how and why we treat, as early in life as possible, malocclusion that we know won't self-correct. And we know what the genomic potential is of pretty much every kid who comes to us. So it's really that simple, but not simple at all.
Yes, so basically genomic potential dictate what every person can have fully developed jaw where 32 teeth would fit without crowding.
But that's
Is that right?
Yeah, it hypothetically. Again, it's a hypothesis, but there tends to be a lot of support for it. Circumstantial support, not based on a prospective blinded longitudinal study, but it is a supportable hypothesis.
So that being said, you advocate for discussing treatment for habitual malocclusion at much earlier age than it's commonly practiced. And I actually lectured last week and I said 3 years, that's the time when we start forming the good habits. And everybody was like wooing me, no, good luck to you, it's not possible. So can you elaborate on that early intervention? It's critical.
Yeah, I think the people who are criticizing you, when they said that's not possible, you should have said, you're right. It's not possible for you because you don't understand it. And I felt that way before too. I haven't always been like this. So think with me, please. Let's collaborate. But I appreciate your skepticism. But if you understand the biology of it, and you understand how children pick up on whatever, if adults are thinking it can't be done, they're not going to cooperate. So, if you're not capable of managing expectations and anxiety of parents and children, you shouldn't be doing this. But if you become curious, if you're a parent yourself, even though you weren't trained in it like I was, because I'm a pediatric dentist, I'm also a dad, um, then get curious about it, and then we can start thinking together. That's my answer to that. I don't get mad at people anymore. It's the curriculum. The orthodontic curriculum in America, CODA, has no provisions to teach residents in orthodontics about pediatric behavior guidance. I had hundreds of hours of it as a pediatric dentistry resident. So that's my main observation.
But what age would you recommend to start treating malocclusion for kids?
But me as a pediatric dentist and dad, when there's 20 teeth, treating it, but actually understanding it and being able to observe traits that aren't going to self-correct. How about in utero? We can see retrognathic chins at 20 weeks gestation. So, that's not treating anything, but that's starting to, observe. That's another hypothesis. We think it starts in utero. We don't know if that's right. We need more data, and we're studying that now. So I'm sorry to be vague in but I just the age to start treating it is when you're best capable and trained and comfortable doing it. Does that make sense?
Makes sense.
Yeah.
And can you give us like a broad overview how that early intervention should happen? What recommendation you can give to the dentist or dental hygienist or dental assistants who actually can influence patients? What recommendation or broad strategy or methodology you can share with our audience?
I'd say again, in pregnant or pre-pregnant women, start talking about when you have your baby. You need to do your folic acid and your yoga, but you also need to sleep well, because babies who don't are born to mothers who have apnea or smoke or things like that. They're premature and they're small. Their long bones are small, and so are their facial bones. There's evidence in the literature about this. You can do a lot before the baby even is born. And then once they're born, nursing and weaning according to an ancestral pattern, which I won't go into here. But those are all strategies. And then when there's 20 teeth in the mouth, or before, you can start doing myofunctional therapy. You can use devices like MyoBrace or MyoMunchie. There's all kinds of orofacial myofunctional strategies that you can use before there's 20 teeth, between 30 and 36 months of age. And then you can start expanding the upper jaw. The upper jaw is, transverse deficiency. That is the first thing that we can really optimize at a young age. The sagittal development also we can start to control that and guide it, but not really get that as perfect as we want to until they're a little older. And the vertical. So that's what I would say. Start it when there's 20 teeth. If it makes sense to you, you understand the science behind it, and the parents can project to the child that this is in their best health interest. If one parent disagrees, then the kid's going to be confused and they're not going to cooperate. That's another hypothesis I have. So.
This is beautiful. Can you please share with my audience? That's my last question. What exactly happened after Industrial Revolution? Why Industrial Revolution was such a turning point in our development?
Women entered the workforce. Women entered into the textile mills and in the coal mines because they were small. A lot of people don't know that. They weren't just in textile factories, but they were in coal mines. And that means they weren't at home, and they couldn't nurse and wean the way they had done for the previous 300,000 years before the Industrial Revolution. That's a hypothesis, okay? And that also means that not only were there not nursing and weaning, but artificial nipples, artificial baby foods that are softer, that started to happen. The air got dirtier. They were, kids were going into the factories. So that is, part, and then it's called the masticatory hypothesis, or what what Mariana Evans calls as the axial loading hypothesis, that chewing with crowns over the roots like this, and the bone got firm, and that just stopped happening with softer diets and less challenge that coincided with the Industrial Revolution. And in areas like, there's still areas in the world that aren't fully industrialized, and they still are forming beautiful jaws early in life, but in a single generation it can go south. They can start to have bad, poor occlusion. From one generation it can happen. So
that's scary. What hard food you recommend parents to use for the baby? What practical advice you can give towards the food what baby should chew? I mean, chew or try to chew after breastfeeding period ended, after weaning.
well, it's not necessarily, it's during weaning that as long as the baby can sit up and they're fully observed, and they can pick things up like a pork chop bone, then you know what? That's fine. But again, I especially moms, rely on your own instinct. Is this something, that my kid can handle and can chew and spit out if they have to? Choking hazards isn't something to ignore, but it's probably not as big a risk as you might think if the child can sit up and be observed. And, fresh, firm, undercooked, minimally cooked, but healthy, clean, organic food. And I don't use the term organic lightly. There's a strict definition of what that is. That's what I recommend.
Thank you very much, Doctor. We really appreciate your insight. And we're looking forward for your beautiful work with the university, with UPenn and Anthropology and Archaeology Museum. Thank you.
Thank you, Dr. Sokolina. This has been